Hello, and thank you for tuning into the program. I'm your host, Neal Howard, here on Health Professional Radio. Now, if you're a parent or anyone who suspects that your child or maybe some other child might have ADHD, this segment is a must-hear for you. Our guest today is returning to talk with us, Dr. James Greenblatt. He's an integrative psychiatrist and leading expert in behavioral and medical disorders such as ADHD, OCD, eating disorders, anorexia, and more. Here to talk with us about his new book, Finally Focused. Welcome back to Health Professional Radio, Dr. Greenblatt.
Thank you. Very good to be back.
Now, when we were here before, we talked about some other things having to do with behavioral health in our children. You've written a book, Finally Focused. Why did you write this book, and why is the title as it is?
Well, I think there's been so much controversy and confusion, might be a better word, around ADHD and parents really struggling with, do I medicate my child or do I not? And it was really an outline of nutritional interventions that might help ADHD, as well as a effective, safe way of using medications if necessary. So we call it an integrative approach.
What exactly is ADHD, and why is there so much controversy surrounding it, especially among children?
Well, ADHD has been described for over 100 years. And over the years, medicine has changed the name as we understand different pieces of it. But it is a psychiatric disorder of childhood. It is the most common disorder that is referred to pediatricians and psychiatrists. And it really is now seen as a genetic, biologically driven disorder of poor impulse control. So not having sufficient brakes in the brain to help control kind of thoughts, behaviors. So it results in inattention and overactivity.
Now, during the 100 years that you were talking about that ADHD has been described in one form or another, it's not a disease, and it's also not a behavioral or a discipline problem.
That's absolutely. So if this is biologically driven difficulties, we need to understand that, and we can treat it, biologically with medicine or nutritional support, or also kind of adapt the environment. The important thing, I think, for parents to know about ADHD is some of these symptoms that we call that might be a struggle in school can be quite adaptive and healthy and create very passionate, energetic, successful individuals.
So what are some of those symptoms that you're talking about?
Well, the positive, is that most individuals with ADHD, again, are passionate and creative and have high energy. So they're the kind of people you want in your team. They might not be as organized and have the same kinds of very rigid practices, but if you utilize their strengths, they'll be quite helpful as both students and people that would be at the workplace.
Are there things to watch for? Are there a lot of things that a parent should watch for, or are there certain little things that kind of stand out when it comes to some of the symptoms that might raise a red flag?
Well, I think the most important thing is understanding. If parents understand what this disorder is and isn't, they're going to be less critical and more helpful in adapting the environment to suit some of the symptoms that these kids struggle with.
Now, you've written this book, Finally Focused. What exactly, is this a book where you can just jump around and say, okay, this is going on, let me go to this chapter, or that's going on, and let me go to this specific chapter? Or is this a step-by-step guide?
Well, I think it's a little of both. I think the book was set up that you can go step-by-step, and the framework is called the plus-minus plan, what things to add. And we try to do it in order of priority. Like the first chapter is on the trace mineral magnesium. And we found the vast majority of kids with ADHD and adults are deficient in magnesium. So supplementing magnesium can be very helpful by itself. So it is set up as a book starting from the beginning as the most helpful. But some of the other chapters in terms of lifestyle, mindfulness, exercise, further down, and parenting. So I think to appreciate the concepts, it's probably important to be able to get through the book. It's written in a very simple, kind of organized format.
Now, we're pretty familiar with the term integrative medicine, the holistic approach. What exactly is an integrative psychiatrist? You mentioned different aspects that are touched on in your book. Are all of these aspects part of what an integrative psychiatrist is as opposed to a traditional psychiatrist?
Yes, I think right now our traditional psychiatric model, physicians trained in psychiatry, is pretty much a psychopharm, medications for symptoms, whether it's depression, anxiety, or ADHD. An integrative psychiatrist really looks at the big picture and integrates nutritional deficiencies, lifestyle changes, a family dynamic, and really integrates all aspects and just has a broader kind of toolbox, if you will, to be able to successfully treat some of these psychiatric disorders in kids and adults that medications have really had limitations.
Have you seen great strides when it comes to controlling, or is it even possible to reverse ADHD simply by diet and lifestyle change without the use of medications?
Absolutely, particularly for our younger kids, these kids under 6 that are struggling, getting kicked out of preschool because of symptoms that aren't being appropriately treated. We've had hundreds and hundreds of cases over the years where medications are not needed, and some individuals where medications are needed, and the vast majority have, again, an integrative medicine and nutritional supplement as the ideal approach for many.
Talk about how your book addresses the problem of responding to a school system or a kindergarten or daycare that says, hey, your child is just a little bit too rambunctious. We think he may need medication.
Well, I think as parents, we want the information from the school system because ADHD, the symptoms are different in different environments. These kids on one-to-one, they might do great. These kids, if they're excited, interested in something, might do fine. So if the school is giving you that feedback, then I certainly would take the feedback, get professional help, but it does not always translate into medications as being the answer. So I would make sure you seek out doctors that might be able to help look at an integrative approach, and there's growing numbers of doctors around the country that are able to do that.
And is there a website where our listeners can go and get some more information about your book, Finally Focused?
Yeah, the website is finallyfocusedbook.com, and there is both research and information and ways to get help for ADHD.
Well, thank you so much. Glad that you could come back and join us, Dr. Greenblatt. Thank you, and I'm hoping you'll come back.
Appreciate the time and good luck. Thank you.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, with Dr. James Greenblatt, an integrative psychiatrist and leading expert in behavioral and medical disorders such as ADHD, OCD, eating disorders, and more, especially as they relate to our young people. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm.